revolutionized the treatment of femur fractures and a variety of other fractures, because people don't need to be on bed rest for the 6 or 8 weeks it takes for this to heal, as they used to before orthopedic surgery. So here's another case. This patient happened to film themselves hurting themselves. So I'm going to see if I can swap screens here. Hang on a second. So we're going to get that one. We're going to do this. All right. Can you all see this? Okay, so let's go back here.
Every so often over here it's safe.
Okay, so this is their fracture. So that's the break there. The space next to where the cursor is over here, that's actually normal. That's your AC joint. And so for a break like this, we fix it a little differently. So we'll put a screw right across the break, which is right here. And then we kind of protect that screw with a plate, which is a thin strip of metal that has holes in it, and we put screws in. And this is what it looks like from a bird's eye view. And you can see that the plate contours nicely to the collarbone or the clavicle. All right, so I mainly do trauma, broken bones. Doing hip replacements is a very common treatment for hip fractures. So I do also do hip replacements for patients who have arthritis. So I'm going to have you vote in the chat. So she's about 2 weeks out from a hip replacement, and I want you to vote which side she had surgery on, okay? So watch this video here. All right, good. Come on back. That was a nice turn, too. On the catwalk. Okay, did you see that? All right, here, I'll show it to you one more time. All right, so vote in the chat which side she has done. Have you guys ever used Zoom before? This is like the slowest chat. Some people are refusing to vote. All right, 1, 2, 3, 4, 5, 6, 7. 7 people voted. How many people are on? 2, 3, 4. Is that 7? Do we have everybody? Did everyone vote? Some people are refusing. Okay, so we got 1, 2, 3, 4, 5. 5 vote for right and 2 vote for left. So you guys are close. It was the left side, right? But the point here is that patients do quite well from orthopedic surgery. So I'll show you her x-rays. So this is an x-ray of a hip, and this is a while ago, kind of before she started having problems. And so the hip's a ball and socket joint. There's the ball. There's the socket. And the space that you see in between the ball and the socket, that's where the cartilage is. And the cartilage is a smooth substance that lets the bones slide past each other without causing pain. And here she is a couple years later. So now, there's no space in between the ball and the socket. That's what we call arthritis. And here's the surgery we do. So we give her an artificial ball, an artificial socket, and then patients can walk again without pain. So, and we do all this through an incision that's about 4 inches. So orthopedic surgery works well, and our concern is function, right? We want to get people back to doing the things they enjoy doing. Okay, so now we're going to have some true or false. So here's question number 1. To be a doctor, you need to be really good at math and science. So I guess we have to vote in the chat again. So most people are voting true. So personally, I think that you need to be good at math and science to kind of get into medical school and medicine, but I think actually being a doctor, there's actually very little of that. So I would argue that I would call this false. And so I think that other skills are probably much more important. For example, empathy and people skills. If you think back at, maybe the doctors you've had that you've really liked, or if you talk to family members, it's one thing to be really smart, but people tend to gravitate more towards doctors that are good with people. All right, next question. True or false? As a doctor, you will never see your family. Okay, so looks like everyone's voting false on that one. So I agree. I think whatever career you choose, whether doctor or something else in the health profession or something outside of health, it will be possible to set your career up in such a way that you don't see your family, or that you do. And if it's something that's important to you, then you can certainly be a doctor in such a way that you do have good relationships with friends and family. This is my family. Okay, next one. True or false? Training takes forever. Okay, most people guessed true on that one. I think it depends. Okay. So I would say true. So for me personally, after high school, so there's college, which is about 4 years, med school 4 years, residency for me in orthopedics was 5 years, and then I did a 1-year fellowship after that. And these numbers can vary based on what kind of medical specialty you choose, but it's not like you're gonna, graduate from high school and then enter the workforce. It is a process. But I will argue that what takes forever is like forever. If you choose a profession, whether medical or otherwise, that you don't love, it's a long time doing something you don't love. Whereas for me, I love my job. I don't, I look forward to Mondays, and they say if you love your job, you'll never work a day in your life, and I think that's definitely true. So if you find something that you're interested in, that you love, I encourage you to pursue it, because forever is a long time. That's how long you'll be doing whatever you choose to do. Okay, so on Saturday, you are on orthopedic trauma call, and I'm told that we're We're getting our OR schedule as we speak. What is on the OR schedule for Saturday? Ooh, there's a fracture of a radius. Between now and then, you'll figure out where that is. And oh, there's a hip fracture. So we're going to be bringing in some bone models as well as some implants. So you'll get to actually fix some fractures and see what we do in the operating room. Here's some x-rays of the bone models. Now, these are x-rays of real people, but we'll have bone models that look like this. So this is a 56-year-old who was in a car accident. So I advise you to study this image, and I will ask you questions about it on Saturday. All right, here's our second case. This is a 76-year-old who fell down in the bathroom. Very common place for old folks to fall. And these are her x-rays. So it may be hard for you to tell what's broken. So maybe between now and then, you'll be able to figure it out. Okay, so I will stop there and happy to entertain any questions that you might have about what we're doing on Saturday, about orthopedic surgery, medicine in general. Also happy to answer questions about life. What questions do you have? You can put them in the chat, or if you're feeling brave and want to unmute, you can do that too.
I have a question. In your experience, how has technology impacted orthopedic surgery over the years?
Sorry, I had my volume off. Go ahead.
In your experience, how has technology impacted orthopedic surgery over the years?
Yeah, I think everyone focuses on the technology and the implants and things like that. And for sure, they're always improving. You know, I recently came back from our annual orthopedic meeting. And when you go in the product hall, there's, I mean, just if you've ever been to the Hawaii Convention Center, just imagine that times 2 or 3, just full of companies showing off the latest and greatest. And for sure, the technology is very cool. But I think honestly, in recent years, the bigger kind of advances have been more simple. For example, the hip replacement patient I showed you, we've recently changed the way we get to the hip. We used to get to the hip kind of from the back or from the side. But to do that, you need to cut into muscle. Whereas when you go get to the hip from the front, you can kind of go in between the muscles, and that's really improved patient recovery, you know. So yes, the technology is impressive, but a lot of times it's quite honestly secondary to what we're doing.
And
I have
if
a
you guys,
question for you.
Yeah.
Was there at any point that you doubted the profession that you're going into, like maybe dealing with patient deaths or anything like that? And how did you deal with it if so?
Yeah, good question. In the same way that there's many kind of branches within orthopedics, there's also many branches of medicine kind of within medicine. And there were certainly many fields that I experienced as a med student, let's say, and was very clear I just did not want to do that. The nice thing about orthopedics is that patients tend to be healthy. They tend to be, you know, you're operating on patients where they're going to be able to get back to, you know, things they enjoy doing. There are certainly other branches of medicine where, yeah, you are dealing with death every day, very sick patients, oncology, for example. And for some people, that's what they want to do. For me, it wasn't really. But I think the challenging thing, you know, for you, for all of you, is kind of figuring out what you want to do. And I think people assume that being in college and, you know, seeing the different professions and maybe being in medical school and seeing the different types of medicine, that they will naturally be exposed to their dream kind of scenario. But I would argue that often tends not to happen. You just don't see that much of the course of regular training. So I encourage everybody to shadow. And that's something you can do as a high schooler, as a college student, as a med student. If you think there's something that, hey, I may possibly be interested in pediatrics, you know, look up a pediatrician and just shadow them for a day or, you know, a couple days and just see what that looks like. I think that's the best way to kind of figure out what works for you and what you're passionate about.
Thank you.
Welcome. What other questions do folks have?
Oh, we have one in the chat. It's from Sienna. She asks, how was your experience with schooling? Did you face blocks/setbacks that made you debate your career path?
I think for me, the biggest thing was the length. It's a long time, and you will definitely, for me, for example, I was still in med school and saw college classmates who were just, you know, living it up, you know, and I was still training. So that was the biggest challenge. But I think so. Both my parents are physicians, so I kind of, my dad's a cardiac surgeon, my mom's a pediatrician, so I kind of knew what the end result was and knew that it was worthwhile. But yeah, there's definitely challenges along the way. For example, studying for the MCAT, it's always painful. But I think the bottom line is if you are really intent on being a doctor, you can be a doctor. You know, it's, you know, it may take a couple tries, you know, getting into med school, but you can do it. You know, it's not that hard, quite frankly. You know, I don't want you to think that, oh, I can't do it, I need to be like some super genius. Like, no, it's, you know, you need to work hard and you need to be persistent, but totally within your grasp.
And that concludes our Q&A. Thank you, Dr. Okike. If everyone can say thank you for his time. And as it reaches about 6, you may all be released. You can just leave the meeting. You don't have to go back to the main session. Thank you, everyone.
Thanks, everybody. We'll see you on Saturday.
Okay, thanks. I'll see you guys on a Saturday. Well, what time Saturday?
Saturday, 10 to 12. And then Aaron Joyo, not Aaron Guerrero, but Aaron Joyo, he's our center director at UH Maui College. He
10
should
to
be
12. Okay.
Mm-hmm. 10
Gosh,
to
that's a long time. Okay.
Yes, yes. And then I don't know if I think I sent you an email, or was it through Jenny that we sent the map as well.
Yeah, I think I have it. I'll take a look. Okay, 10 to 12.
Mm-hmm. Yes. All right.
Okay, see you then.
Thanks. Aloha.
Bye.
Bye-bye. Dr. Okike, you have any other questions?
Nope. Good.
All right.
Hey, Kanu. See ya.
We look forward
Hey,
to
Andrew.
seeing you.
Okay, bye, everybody.
Aloha. I could remove you, Dr. Tan. Okay. Who's recording? Can you guys stop?